Yeah, it's all right.
Okay, perfect. So, Sanas, could you start recording it? Okay, guys. So, yes. So, okay, guys. So, welcome to our webinar about in periodontology, and specifically about indices and patient education. So it will be me and Sanaz and Umama who will present it for you. We will go over some stuff, and if you guys have any question on the way, just give it like a hands up or whatever you call it, and we will answer it. Okay, so yeah, periodontology. So the first thing we will talk about, it's patient education. And patient education, it's like in dentistry, that's one of the main important aspects that you have to know, be really good at, because just professional cleaning or the yearly checkup of patient to come to your clinic, it's not enough for have a good oral health. Because you have to teach the patient regarding how to brush their teeth, regarding their diet, and many other stuff, part of the how to say it, the aspect, the situation to have a healthy oral cavity. And again, like history, because you have to when it comes to base patient education, you have to know the history of the patient regarding like their environment or previous dental history or other health history to know exactly how to help a patient to have the best possible oral health. So educate and motivate, that's the important part of patient education. So like I said, about history, that's when we are talking about amnesis, like about family history, like it could be some genetic that it will affect their oral health, like if they have like some dry mouth, about some diseases that cause it, that like autoimmune diseases, which cause like, let's say, dry mouth, and that's, you have to be careful about that, like help them how to take care of it, because if with dry mouth, it's susceptible more for caries. In the background, again, where they are from, about how their, how to say it, their diet looks like, and also experience about, like, because dentist, it's like since you're a child, about dentistry, like a dentist, that's a scary dude with a long needle, and they're gonna pull out all of your teeth. So it's like you have to try to like have see what kind of experience they have. If they are scared, if so, then you have to try to figure out a way to gain their trust. So again, like educate, that's when we are talking about, like I said, communication, about the experience. Like they can be scared, you have to listen to them, you have to have the communication, give them, like gaining them their trust, because if they don't, if you don't gain the trust, they will not trust you, they will not listen to you, they will not hear what you have to say, to even though it's for their own good, because it's just like this, the fear they have in their mind. And then about the oral care, if they do brush their teeth, if they do actually take care of their oral health, it's not about only the day before coming into the dental checkup, they are brushing their teeth for 10 minutes, or trying to use mouthwash and so on, and think that's more than enough. They have to know that it's not just one time thing to do, you have to do it every day. And about the food and consumption, because we know about the food, like we know from before, like sugary food, because it's basically one of the main causes of the getting caries, but also acidic, because let's say orange juice, it's supposed to be healthy, like it is healthy, but also the acidic will cause what, how to call, bad, the acidity in mouth, and it will cause basically caries because of the saturation in mouth. And also like cracking, because it's something like people do, even from famous people to ordinary, like using their teeth as a tool, like opening a bottle or cracking a nut or something and stuff like that. We have to figure out exactly how they are using their mouth and teeth, and how to prevent that something bad will happen for it. And then we are talking about, like I said, proper toothbrushing and interdental cleaning. That's one of the main things. It's not only brushing their teeth, but they also cleaning between their teeth, because they think only by brushing it will be helpful. Of course it is, but also you have to remember, it's space between the teeth that food and bacteria will be stuck, which again cause caries. That's one of them. No, like the how to say it, the usual caries are like interproximal area, which, as you know, class 2 cavities, and there it's not so easy to find out, like, because if they have like occlusal caries, if it's too deep, you can kind of feel they will have some pain or something, but in occlusal it will take a bit more time, and it's like harder to find out about it. And also when it's about toothbrushing, that's when we are talking about how to call, like, finding a good toothbrush, because one thing is important, the bristles, because it should not be too hard. Like soft bristle as a normal common thing is the best thing, so it doesn't abrade your teeth, abrasion of the teeth, because the enamel it's the hardest tissue in the body. But again, if you use something hard on it over time, it will affect it. And the types of toothbrush, you have the manual one, which is like this one, as you see, and also electric one. So that's like something they have to talk with the patient regarding their needs and how to call, like skills, and also the size, because you have to know, like, not all mouths are the same size, so it's important to tell them, like, maybe getting a smaller size toothbrush to manage to have a best possible skills on toothbrushing. And it's when it comes to also interdental cleaning, that's when about the method, like you have that with flossing or interdental brushing. So again, about the toothbrushing, so like the question is always how often and duration. So we know that the not like standard rule, it's like twice a day, at least minimum twice a day, in the morning and in the evening, like at night. And for how long? 2 minutes. But again, it's not, it doesn't mean exactly 2 minutes, no less, not more, because especially in the beginning, to learn to brush properly, it could take more than 2 minutes. And that's why, like, we have to say minimum 2 minutes, never say, oh, 2 minutes is more than enough. No, minimum 2 minutes is the best optional answer. And this last two, this is what I use usually, 2. The last two, it's about how long to use a toothbrush, because you cannot use one toothbrush for the rest of your life, because the bristle will get destroyed, and which, if the bristles get bad, it will also affect your teeth. Even though you brush your teeth, in the long run, it will also destroy it, even though you are cleaning your teeth. So when we are talking about toothbrush techniques, we know we have like couple methods, and the first one, which is the standard or the most accepted method of toothbrushing, it's the Bass method. And this is basically, as you see in the picture, and later I will show you guys by the model, it's like by holding the toothbrush 45 degrees to the gingiva and into the sulcus, because you know, when you have calculus, this sulcus, the calculus will also be in the sulcus, and that's why you have to be also important to clean the sulcus also, because that's where you it's not so easy to visible to see it. And the movement, it's like vibratory and circulatory. I cannot say that word, but yeah. And that was one of the reasons, like dentists, and we are also future dentists, we should recommend our patient to use electric toothbrush, because it makes it easier for you to brush, and easier to, like, having the better skills to brush, like clean your teeth properly, because even though it's you can do it with manual one, but still you have to learn to do the circulatory movement and vibratory at the same time to make it best possible brushing, because like the horizontal one, it's not a good way to do it, because it's too much of it. Again, it will cause abrasion, which is basically removing the enamel of your tooth, and it's also bad. And this toothbrush technique, it's like I said, it's like the most accepted. So it's, if you can do this, it's the best possible way. Like, it's good for patients with or without a periodontal involvement, or even in the cleaning the interproximal area, basically interdental space. If it has big space, you can use that same technique to also clean it, and also beneath the height of the enamel, basically where the contact point is, right underneath it. The second one is the Stillman. Oh, I forgot to mention about BASS method, because this is the normal one, as you see the picture. I will also show it later, but the modified one is just like you have the swiping technique at the end. So when you brush your teeth, usually you brush like 2 teeth at once, like and after that, after you do the movement, you do a swiping technique away, and that's the modified one, and that's the BOSS method modified. It's the best option because you have the swiping and removing the debris. Stillman is basically almost the same as a BOSS method. The only difference is like this one, it's not only in the sulcus, but it's also on the gingiva and sulcus. So some of the bristle will be on the adjacent gingiva and also in the sulcus. And this will cause also important things, especially in massaging the gingiva. It also helps really nice for it. And same thing, you have the 45 degree, which is that, and also I forgot on both of them, the toothbrush is 45 degrees going gingival direction. So it's yeah, the bristle is 45 degrees gingivally, as you see on the picture. And also like this, like I said, because of the massaging of the gingiva, so it's good, really good for gingival recession and for stimulation of the gingiva, and also clean large embrasures. Again, the spot between the tooth, like under the contact point. And then we have the Charton method, and this is kind of the opposite direction of the previous two ones, because this time the bristles are 45 degrees occlusally, and this, you have the same movement, but the only thing is this is good for like when you have a periodontal surgery, because you have to try to not irritate the gingiva, or when and also with other appliance, like if you have braces, or if you have like bridges and stuff. This technique is the best suitable technique for this type of scenarios. And then you have the last method, it's phone method, and this is basically the best method for children or people with disabilities, because it's easy to do and easy to learn. And this is basically you have that, like I said, like the bristles are angled towards the teeth and the gingiva, and it's like just in a circle. That's like one of the way to learn a kid, because kids to learn the kid in the beginning, the way you do it, like asking kid stretch their arm and then making a big circles, and then make the circles smaller and smaller and smaller. And that's one of the techniques like that's one of the way to learn a kid how to brush their teeth with phones method. And until like when they are 6-7 years, when they learn that like their dexterity is getting better, you can learn them the proper techniques, or like the adult technique. And then we have the like I earlier mentioned, the interdental cleaning. Like you have two methods. One of them is the flossing. Probably all of you guys know the easiest way. Break 20, like the floss 25 centimeters. On the picture is like on that, like in the picture it says 40, but it's basically depends. It can be 25, 40. It depends on, just to have a best possible way to do it. And then you surround it between your middle fingers, and then let me show you guys. Actually, I can. Actually, when I will make this camera, like the screen bigger, and I will show you. But again, you make it like surrounded around your middle fingers, and then hold it at the between your index and thumb, and then you just go between your teeth. But the important thing is it's not only going down and up, but you have to make a C shape, and also go under the sulcus, what I was talking. That's where also plaque can be built. Also plaque can be built. No, can build up. Yes. And make it a C shape, and then go up and down. But it's just like against the tooth wall on all teeth, and also especially it's really important to the last tooth, like your, let's say if you have a wisdom tooth, or the last tooth could be second molar, but always important that you do also clean the last, like the behind, like the distal part of that tooth also. And then the other way of interdental cleaning, it's basically interdental brushes, and this is like it's a good way and recommended overall for all like cleaning over interdental brushes, because like I said about the flossing, some people just go down and up without pushing the floss towards the tooth wall or the like tooth tissue and cleaning it. So, but with this one, if you find the correct size, you can just like go in and out like 2-3 movements, and it will actually clean it. So this is like one of the ways to do it. And like personally me, I use that instead of using flossing, and I feel like that's the because especially but my posterior teeth doesn't have so big space, or I have like struggled to use the floss. So with the interdental brush, it's really helpful. And yeah, like about the replacement here also, it's not as long as a normal toothbrush, but this is like you have to basically see, because it's a really soft bristle, so it gets easily destroyed. So when you see the bristles are bending, or the wire is bending, so you should change it, because you have to be careful with toothbrush and interdental brush. If the wires or the bristles are bent, it will do harm for your teeth. Yeah, like beside that, let me just, if I stop this presentation for a second just to show you. I don't know if I can make my camera bigger. Yeah, oh yeah. Okay, so like okay, what do you guys see now? Do you guys see me, or do you guys see the presentation?
Both.
Okay, but
We see the both.
okay, so basically, before you answer these questions, I want to show you guys the different techniques, because of course you see it in the picture, but also it's important to see it in real life. So the first one was the Boss technique, which I said it was the most acceptable way. And as you see, so this is the jaw. So the toothbrush should be, let's say, of the upper jaw. Let me just zoom it. Upper jaw. So the toothbrush should be 45 degrees like that. And this is when I'm like, you do the vibrating method and the circulatory method, and then you have the modified version, which is after you do, let's say, like this, covering 3 teeth. So there you go like this, and then you do the swipe, and you do this for all the teeth, vibratory for a couple of seconds or movements, and then swiping. That's like the swiping technique for for Stillman and Boss method is the same way. And same, you do the same thing from inside, the same technique, 45 degrees towards the apex. Yeah, like this, do the movement, and then you swipe up, and so on and so on. And then of course for the occlusal, it's easy, just horizontal movement. And it's really important to not do this, like, even I have done it before I learned the proper techniques, like do the horizontal and also as hard as possible, because that's not helpful. Because I know people are brushing their teeth, like friends and family. After I started studying dentistry, I asked them, how do you guys brush your teeth? And they're showing, I'm like, no, that's wrong. They're like, yeah, but we are brushing hard. We should brush hard. I'm like, no, that's not the way to do it. Brushing hard doesn't mean you clean your teeth better. It just means that your teeth gonna be destroyed sooner. And then we are talking about the interdental brushing, and it's basically you go like horizontal, you're holding it horizontal, and let me just, yeah, and then you go in of it. Wait, sorry, I'm not so good with the camera. Yeah, like that, and then yeah, like this, and then you just continue with all of the teeth until, yeah, cleaning it. And then when you see the toothbrush, because this is the old one, when you see this one, like if it's like, let's say like it's bending or something like that, that's when you know that interdental brush should be changed. And then yeah, like, oh, the last one with about the kid, like the phones method, I call it kid method, but yeah, like this is basically again, you're holding it horizontal, and then you have to, it's not only on the tooth, but also a bit bigger circle that it also touch the gingiva, and then you go like just circular movements. But yeah, that's basically what I had to say about the basically education and toothbrushing. And so which okay, yeah. So which toothbrush technique is the suitable for children? I said it also earlier now, but let me see if you guys know it exactly.
It's not a test, we're just discussing, so you can just
Yeah, like because it's not like it's just like so we can talk so see if at least you guys could did understand or not. So like basically which toothbrush technique is suitable for children, and like I said, this toothbrush technique like for children is the fonts because why? Because it's basically easy to teach the kids and also for the kids to do. And so this one I didn't say it, but I want to know if what you guys do. So what do you do first? Do you floss or brush your teeth? In which order do you do it?
Floss.
First
what I do.
brushing.
Yes, like the best option is flossing because by different research and stuff also has talked about it. Because when you floss first, you are how to say it, releasing the debris between your teeth, and then after you brush, you're removing it all easily. So the best option, or the like basically the recommended way, it's floss first, then brush. But of course, if you brush first and then floss, it's also good because at least you are flossing. But to clean your teeth best possible way, you need to floss first and then brush. And okay, like if you have no complication, basically you have no oral health problems, your gingiva or teeth are well, which toothbrush method or is the most accepted one? Like which one should you use or do without any problems?
Boss.
Yes, like the bus, because this is the because this one you clean the sulcus, and if you don't have any, like let's say if you had periodontal surgery, or if you don't have any bridges or let's say braces, the best technique to brush your teeth is the bus method. But do you guys have any question regarding toothbrushing and in general patient education? No? Okay. So then we will go over indexes. Let me just there.
All right, so indices are basically just short examinations. We'll be talking about the ones that we use for individual patients. There are a lot more that are used for epidemiology, but we will be focusing on the ones that we use in the clinics. So they are short examinations, but they don't exactly provide you the diagnosis. They just give you an idea of certain parameters, whether it's plaque or gingiva or oral health in general. And so we'll discuss that. So for different indices, we have different divisions of the dentition. We have quadrants. There are sextants, which are as you can see in the top right picture, that's how the sextants are, and Ramphur teeth are specific teeth for examination. And okay, so we can talk about the different divisions of indices. We have plaque indices, gingival indices, and periodontal and treatment indices. The ones we'll be talking about are proximal plaque index, interdental hygiene index, which are very similar actually, and then gingival indices we'll talk about PBI, papilla bleeding index, and CPITN for the periodontal indices. So as you know, periodontium, the basic definition is just the supporting apparatus of the tooth. So for periodontal indices, what you can assess are a bunch of different things. We can assess the severity of the gingival inflammation. We can see the severity of periodontal destruction, how deep periodontal pockets are, or yes, how deep the pockets are. We can see the amount of plaque accumulation because, as you know, plaque and calculus are big factors in periodontal destruction for pockets, etc. And so the whole point of these indices is that we can detect pathological changes over a course of time. So it's not just that you do the examination once and you have information. You have to do it in multiple appointments so that you can actually see if there's progress or if the situation is getting worse. And so that's why we use multiple examinations for indices. So let's start with API. API is just the proximal plaque index, which is the presence or absence of stained supragingival plaque in the interdental spaces. And as you know, there are 7 interdental spaces in each quadrant if you have a complete dentition. And with a complete dentition, you'll have 28. So in the first and third quadrant, we check the interdental spaces from the oral side of the teeth, and then in the second and fourth, we check it from the facial. And in the following visits, we switch that order and we check from the oral side, we check the second and fourth quadrants and the reverse for the first and third. So for API, it's important that the plaque is stained, and this is more important for the patient, so that they can actually visualize it. Most of these indices, they are for patient education and motivation. So it's important for them to actually visualize it. So how you actually stain the plaque is either you dip a cotton ball in there are these disclosing solutions. They could be purple, red, pink, and you could do that. You could hold them with forceps and just stain the teeth, or you could give them chewable tablets, and there are also rinses. But it's important that there's good illumination and that you rinse off the excess. And you can see that the plaque is going to be stained, and you have to show the patient in the mirror, of course, that you can see the areas. This is where the plaque is mostly accumulated. This is where maybe the toothbrush doesn't reach. And so it's a good way of showing them and explaining exactly what's happening. So of course, we don't actually start with the interdental space between the central incisors, but we start with between the central and the lateral incisor, and then we move distally. So you record presence of the plaque in the interproximal area as a plus, absence as minus. This is just a table which is an example, because usually people just in general, you can see it's okay. So you can calculate it as number of locations with the plaque, which is all the pluses, divided by the number of evaluated locations. So if you have times 100, because API is a percentage. And so if you have a full dentition, then you will have, in this case, this is a full dentition, and you will have exactly 28 locations that you locate, and 18 of them are pluses. So 18 divided by 28 times 100 will give you 64%. And then this number you will discuss with the patient. The 64%, you have to know that the optimal values for API 0 to 23% are optimal, of course, because that's minimal plaque in the interproximal areas. Then 64 lies in the suitable region, so you're going to tell them, all right, this is okay, but let's see if we can try and improve this. And in the next checkup, see how you check again what the API is, and you can let them know that the number has gotten better. But yes, this is when the patient education comes in that Alan talked about. You have to let them know how exactly to improve their oral health, how to clean those interproximal areas with the brushes or floss. Then we have the interdental hygiene index, which is just the inversion variation of the API, but instead of plaque locations with plaque, we'll be counting locations without plaque, and that's going to be your plus sign. So this is actually a table of the same patient, but hygiene index, the interdental hygiene index. So in this case, it would be 10 places without plaque divided by 28 times 100, which will give you 36. And this, so 36, this will be the opposite of API, so you'd have the optimal values would lie between 75 to 100%. So you would describe that to your patient as, like 75% of the interproximal spaces in your dentition are free of plaque, which is great. So from a psychological point of view, it's more regardful to the patient the way you're presenting that information, that this is good, you have these many plaque-free areas, or so it's interchangeable, whatever you want to use, API or interdental hygiene index, but yes, this is just a more regardful relationship to the patient. Okay, then this one is a very important index, of course. PBI is papilla bleeding index. And so here we're assessing the intensity of bleeding from the marginal gingiva when you irritate it in the papillary region, and you irritate it with a blunt probe. So this has 4 degrees of, it indicates, there's a range of 4 degrees of gingival inflammation, 0 to 4. And PBI is really good oral hygiene motivation for the patient because as we'll talk about, they'll be holding the mirror, they'll be watching what's happening, and the numbers, I will get to that. So it's good oral hygiene motivation for the patient. And same thing, there would be 7 distal papillae. There would be 7 papillae in each quadrant. And so what we're measuring are the bleeding from the papillae. I wrote distal because we start from between the central and the lateral incisor, and then we continue. And again, this has the same thing, where first and third quadrants, you start from the oral side and you measure the second and fourth from the facial side. So the steps for taking PBI is, first you have to place a cotton roll or any folded cotton pad for space, and excess saliva, of course, making sure that it's away from the actual papilla so that it doesn't suck up the blood and you can't see it. And then you need to air dry the quadrant just to make sure there's no saliva to maybe disrupt the results, because if there's saliva, then the blood could spread, or some numbers could be higher than there actually would be. Then you have to stimulate the papilla of one quadrant at a time. Start between the central and lateral incisor, and then you finish between the second and third. Or if you don't have the third molar, then you just finish with the papilla behind the second molar with the half papilla. And then you probe basically from within the sulcus. You probe it from the base of the papilla to the tip of the papilla, and this means kind of midway of one tooth to the papilla, and then kind of the middle part of the second tooth in the opposite direction to the papilla. I don't know if that made sense, but kind of in a triangular shape just across two teeth. You have to do it. And then it's in 20 to 40 degree deflection from the tooth surface, and you have to use light pressure, but enough pressure that the gingiva is irritated, but it has to be light, otherwise you would be destroying the junctional epithelium. And then you wait about 20 seconds after probing just for the blood to appear, and so you will then record it. So as this is happening, the patient should be watching in the mirror, because as I said, this is a good index for patient motivation. And so once they see the blood, they'll be aware of what's happening and the status of their gingiva. And then according to the chart, according to the scale, you're going to record it in the chart. On the right side, we have a picture of an empty chart just as an example. So it shows you the first and third quadrant should be taken from the oral side, second, fourth from the facial. Where the arrows are, that's where you record the total of the total of the quadrant. So there are 4 separate boxes. Those are for the quadrants, and then the arrows are pointing towards the total. Okay, so the scores are, as I said, ranging from 0 to 4, 0 being no bleeding after irritation, 20 seconds after irritation. 1 is if you have point bleeding, and you can see the picture in the picture below. And then second score is if there's a line of blood, or if there are several points that are bleeding. The third one is if there's a triangle and the interdental space is slightly filled. And then fourth is a drop, or the blood is flowing to the adjacent areas. If it's flowing to the other tooth, then that's a lot of bleeding. It's counted as 4. So how you calculate it is the sum of bleeding papillae. So yes, the sum of bleeding papillae over the sum of examined papillae. So if you have full dentition, it should be something over 28. So it's better to actually share the sum value with the patient rather than the actual PBI, just because the sum is a really large number, and it can range from 0 to 112, because I haven't shown the math here, but if you have 4 in each interdental, for each papilla in each quadrant, that'll be 112. So you have a really large range, and these numbers are more, they're easily comprehensible for patients, and so it's better to share the sum value and tell them that, okay, your bleeding is this number. And of course, excellent oral hygiene would give you a range 0 to 10, which means there's minimal bleeding. And this is an important factor in patient motivation, just because they can see large changes as well. So if you have like a 60 initially, and if they take care of their oral hygiene for a while, it's going to drop a lot, the sum value at least, but you can't see that large of a change in the actual index. Some of the factors that we should consider is that we'll get different results in different cases. So if the person is a smoker, then usually the PBI is less, because the gingiva won't be bleeding too much once you probe it. Or if the person is pregnant, then there could be some more bleeding that could be expected, which aren't true results. It's just we need to keep that in mind. And also this index is contraindicated for patients with any diseases, with any hemorrhagic diseases. So anything that could where bleeding could be a problem. So this is just one that is filled out. just for an example, as an example. So as I said, the rows in the middle, those are the total of the quadrant. And so as you can see right in the center, 20, 18, 17, 3, those are for the quadrants, and you add that up. And this patient did not have tooth number, I don't know, I'm not sure which one it is, but they did not have a second molar. And so that you use that as a cross where the arrow is pointing, you just put a cross there if there's a tooth missing. And yes, so the important thing about an absent tooth is that you would still measure the space where the tooth isn't, so that you would measure the space, the interproximal surfaces of the teeth that do enclose that space. So those are half papillae, and that would still count as one space. But if two teeth are absent, then that's one whole test space that is skipped. Yeah, so on the right side, you can see that it's filled out. The bleeding was 58 over 27, and then initially, and then eventually it went down. And it's so, like I said, it's better to tell them that, oh, your score was 58 and now it's 17, rather than, oh, it was 2.15 and now it's 0.63. So it's just better that way.
Okay, now I'm talking another examination, CPI-TN, or Community Periodontal Index of Treatment Needs. This is one of the universal screening tests that we are detecting inflammatory plaque-induced periodontal disease, and it will give reliable information to the dentist about the treatment needs, but it will not give any information about diagnosis. And usually it consists of CPI with a 0 to 4 value and TN 0 to 3 value, which I will explain later. And despite the other examination Umama said, this examination we will divide the dental arch to 6 stands. That the first one is frontal 6 stand from canine to canine. It means incisor and canines, and two other lateral 6 stands is premolars and molars. And for the normal people or individual use, or the age above 18, we are using all functional teeth. So it means all canines and incisor for the frontal 6 stands, and for the lateral one, all premolars and molars, except the last molars. But at the age below 18 and the children, we are using just only one tooth, one design tooth, which is out of parentheses. And if we are missing, for example, the tooth 1-1, we will use 2-1 as a substituent to measure the CPI-TN. But for the lateral 6 stand, if we are using the second premolar instead of the first one, we will get some kind of error, especially for the periodontal pocket. So the value is quite far from each other, but still we need to use as a substituent. And for CPI value, it's when we are evaluating the teeth, we are recording all around the surface of the teeth from mesial to buccal, oral, and distal part. And usually for each 6 stands, the highest value of the CPI it will be considered, and the parameter, it will evaluate the bleeding on probing, presence of any calculus or iatrogenic irritants, and also periodontal pockets. And for the examining, we are using periodontal probe, and which is has ball-shaped tips by 0.5 millimeter in diameters, and the black part or black color zone from 3.5 to 5.5 millimeter, which is from the tip of the probe. And we will use the periodontal probe by light pressure under gingival margin or in gingival sulcus, and all around the teeth, as I mentioned. For it can be started from the mesial to the distal part, or vice versa, but it need to be measured all around the teeth. And here is the table showing the indices or value for the CPI and TN. For the 0, so obviously it's a healthy person. For the index value 1, it's when it's getting irritated, the gingival part, and we will see bleeding. And for the second or number 2 index, this is about calculus. If you are having deposited dental calculus or plug, or when we are trying to touch the surface around the tooth, we will see some roughness, then we can say there is calculus there. It can be supragingival or subgingivally. And for the high value of the CPI, the periodontal pocket is it will be happening there. When it's on the picture later, I will show you that how would be the evaluation for this one. But for the number 3, it will the value 3. It says that periodontal pocket depth is up to 5 millimeter, and the pocket more than 6 millimeter is number 4. And for treatment needs, if the value will be 1, so it means the patient need to improve the oral hygiene. And for the number 1, sorry, and for number 2, beside increasing oral hygiene, they need to do calculus removal or scaling to another appointment. And for the number 3, all these things I mentioned above, plus some complex therapy, could be surgical or gingivectomy and the other stuff. So here, as you can see in the picture, for the CPI code 0, it's when we are trying to put the probe slightly under gingival sulcus, so it will just it will be covered only the tip ball of the probe, and we can't see any bleeding, and it's not going further. So this is 0. But when we try to press a little bit more, we can see bleeding, and which is showing us value number 1. And when we try to check the gingival margin, we are not seeing any bleeding, but we will feel the roughness, or we can see the dental calculus deposit. So this is showing the CPI value number 2. And while we are trying also to check the gingival margin, if we see that the black margin is going submerged under the gingival margin, so this is could be CPI-TN 3 or 4. So how we can recognize, as we said, if it's not covered completely the black zone, so it means like below 3.5 5.5 millimeter, it's number 3. And for the code number 4 is when it's completely, it will be disappear the black zone. And also it would be possible we can see bleeding or any dental calculus deposit for CPI 3 and 4 as well. And this is just a very schematic picture that will show you that the periodontal pocket and periodontitis, how it will be different with a healthy person. That as you can see, with inflammation of the gingiva, and as well as plaque and calculus around the tooth surface by a periodontal pocket, it will happen. And for a treatment need, for the value code 1, we said we will improve the oral hygiene, that we can follow up this patient education and home care. And for value number 2, the treatment need is it's the best option is removal of the calculus and scaling. And for number 3, it's the complete therapy, so it would be some surgical or advanced method that it will be mentioned later. So as I said, treatment need is just determine the best possible way that we can treat the situation but not diagnosis. And for example, if the patient has CPI 3 and TN 2, so it means the patient can have even gingivitis and periodontitis, so it's not the best case to diagnose the patient. Just we can say how they can improve the CPI TN value by home care or scaling or any other method. And bleeding also, as I mentioned, it can be also happen in when you have CPI 3 and CPI 2, and beside that CPI 1 that it usually is bleeding. And this is the figure that you can see as an example. So for each 6 stand, we will consider the highest value for the CPI. So here you see if we have 1, 3, 4 for different teeth in lateral part, but still we consider 4 as the highest number. Now there are some questions as a review. So if the patient has no bleeding and no calculus but pocket 4 millimeter deep, what is the CPI code then? Any idea?
Should be 2 or 3? Or am I?
Yeah, it's 3. So from 3.5 and 5.5 millimeter is the 3. So if the patient, it will be treated from this dental pocket will be healed and the depth will be 3 millimeter. So then later will be CPI.
Still 3?
No. 3.5 to 5.5 will be the CPI 4, CPI 3. So when it's below 3.5, so it means there is no periodontal pocket. So as we didn't mention, no bleeding, no calculus, so it means this patient is healthy, so CPI is 0. So what is the difference between PBI and BOP? PBI, it was papilla bleeding index, but this one is bleeding of unpropping.
So the main difference is that PBI is just the bleeding from the marginal gingiva, just from the sulcus, and bleeding on probing, you can, it's more about the deeper tissue. So within the pocket, when you probe, what if there's bleeding or not. So it's more about the deep tissues for BOP.
Yeah. And when we can use soda pockets? Or ever you heard about it? Any idea?
It's basically gingival hypertrophy.
Yeah, hyperplasia.
Like with drugs and so on.
Yes, and so that actually, so if there is gingival hyperplasia, then CPITN, the main purpose of it, of course, is not valid. It's not a valid test for such a situation. And another thing to add about PBI and bleeding on probing is that PBI is very easily influenced by oral health, so which is why we use it for patient motivation. But bleeding on probing is not influenced too much by oral hygiene that the patient does, just because it's more about the deeper tissues, and so it's more for just checking, like I said, in the pockets.
Okay, so as I said, when you had CPI 3, roots and you see deposit dental calculus or any plug around the tooth. So this calculus might be above gingival margin or below. If it is located above gingival margin, it would be supragingival calculus that for removing, we are using hand instrument, hand scaler, which is in the left picture, and or ultrasonic that the left below, right below is ultrasonic one, and the other one is sonic scaler, which is used with the power, with the air power or water power, and with a little bit vibrating with a micromotor that can be used. And the other type of the calculus is subgingival. It is a few millimeter below gingival margin and could be mostly around the roof or the neck of the tooth. And we are using the beside this scaler, we can use a carotid. We have two types of the carotid, this universal and Gracie. That universal, they have two cutting edge, and the Gracie has one cutting end that which is by touching we can see it, and even though we with checking the cross section, we will see some orientation or slope on Gracie carotid, that which is it's going down is the sharpest point, and the other one is more blunt. And for universal carotid, we have color coding, and which is the yellow for the universal one, and for all different teeth we can use, and orange one mostly for the anterior one, and red for posterior design. And we said also another type of carotid is the Gracie, that we have minimum and complete set. And minimum set is usually it will be used for in any dental offices, and we are using this color coding. And usually this Gracie carotid is used for mostly root planning or more deeper more deeper removal of the dental calculus, and also for some complicated parts like most posteriorly, and also with some different shape of the roots or the exposed roots between the roots, it would be possible to use this Gracie carotid. And the other one is complete set, which is we have more type and for somehow more specific, and they have mostly two-ended parts, cutting edge, that we can like there are two ends of this carotid, that which one of them would be, for example, for right one, and the other one for the left one we can use. But I will explain more details the next slide. For anterior region, and I should mention before that for each region of the delta arch and each tooth, is better to remember this numbering than color coding, because in some different sets or different company, usually they are using the different color or no color, but usually you can find easily based on code. And for anterior one, we will use the yellow, and 5, 6 is the number we can use. And usually for removing the calculus, it's better to be parallel or with the axis of the roots, and we will go deeper and remove the calculus. It's hard to explain the procedure, but it will be in this way at the picture. And for a posterior one, we have more type, because it's not easy to access different parts of the tooth surface. So we have for mesial and distal separately, as well for the buccal and palatal one. For the mesial one, number 11, 12, and the red color usually used. And as I mentioned, for each quadrant, we will swap the karate for to find the sharp edge that we are working with it. So we should be careful that which point we are using that is exactly removing the calculus. And the other one, it's 13 and 14, the code for distal part, and usually with the blue. And also we should be careful that we are using the cutting edge, and also for the distal and mesial posterior part, we have more angled, or if you can, you saw based on the picture with the anterior one, if you compare, here is more rounded or more contra-angled, which is making it easier for us to access to the red point or more back on the teeth. And we are using also the ring finger that somehow balance the hands and on the horizontal part of the teeth, and then by movement of the wrist we try to reach the distal or mesial part. And for, as I said, for buccal and plateau part, also we have different carotid, which is the with the color coding gray or sometimes also white, and the number is 7 and 8, and we are putting the carotid parallel with the axis of the tooth, and try with the cutting edge removing the calculus from the teeth. And I think that's all. If you have any question, we would be happy to answer.
Thank you so much. I
You're
appreciate
welcome. So it is not. Okay, I hope you enjoyed and you learned something. We try to make it very short, as short as possible, and to be informative. Thank you so much for your attention.
Thank you so much. And it was like, I hope, like Sana said, I hope it was helpful. Probably most of it was just repetition for you guys, but at least it's nice to see a bit more explanation, and also later, so you can just rewatch this if needed, especially when your preventive exam comes up, and yeah, on YouTube channel, our YouTube channel, and you can rewatch this just for revision. Thank you so much for those of you who came and listened to us, and I hope you guys have a nice weekend until tomorrow and a new week of school.